Hi, I'm Joshua Elston, and today I'm going to answer 5 common lipedema questions. One of the most common questions that comes up for me and in the initial consult is, how many cases have you done? So I do about 6 to 8 lipedema cases per month that vary from stage 1 to sometimes stage 3, very rarely stage 4 cases, and overall I've done about 75 to 100 cases in the last year. The second most common question that I get from patients when we're talking about lipedema liposuction surgery is, how much fat can you remove in one session? So if you are planning on going home or having outpatient surgery, it's 5 liters. That's a legal requirement. It has to do for safety reasons. So if we're doing any procedure awake in clinic, which is my preference, or if we need to go to a surgery center, then it's 5 liters. If you choose to go to a hospital and you're going to stay overnight and you have a nurse monitoring you, we're giving you fluids, we're checking your blood count at the night or in the morning, then we can do even more than that. For me, the most that I've ever done is just above 13 liters, but you could go anywhere in between that 5 and 10 to 15 liters, and as long as the patient's appropriately monitored, it can be done in a safe way. Patients that have lipedema often need multiple surgeries, and the tendency is to want to clump them all together and get them done as quickly as possible. Especially if you're coming from out of town, you really don't want to have to travel or fly multiple times. So patients will often ask me my third most common question, which is, can I get multiple surgeries done in the same week? They want to come in on a Tuesday and have the first one, heal up for a couple days, and then have surgery again on Friday. It just doesn't really work great for me. I've tried it twice, and both times we've ended up having to cancel the surgery because the patients are just wiped out. So if you end up asking me that question, the answer is usually no, because your body's just not ready. You need time to heal and recover from surgery. Everyone that has lipedema is also concerned about, if they have surgery, they spend money, or they go through the insurance approval process, is this going to come back? The best data that we have available shows that at about 10 to 12 years afterwards, as long as there's no significant change in weight gain, any menopause, or significant life events like having a child, then this should be good. You should not have to have revision of your liposuction for lipedema. The final question that I get very, very commonly is liposuction for lipedema fat different than liposuction for standard fat? And I would say yes and no. The technique is different, but it's all still liposuction and sucking fat. It's just where you find the fat. I find that there's a lot of patients that come in for revisions that have had lipedema liposuction surgery elsewhere, or maybe their surgeon didn't even know what lipedema was. They were just doing liposuction. And those patients tend to come in undertreated because the lipedema fat itself is not addressed. So in my technique that I do, and it's not that I came up with this, but over dealing with all the lipedema patients, I find that if I'm not doing things a little bit differently than for my standard cosmetic patients, that I undertreat the lipedema fat. So it's still liposuction, still done the same way, just to a different order of magnitude. Thanks for listening in for these questions. If you like this, let me know, and I'll try and post more videos like this. Otherwise, if you haven't been in for our consult, we do free virtual consultations. We're in the Pacific Northwest, and we treat lipedema patients of all stages.